Imagine this. You've just opened your dream clinic. Your chairs are shiny. Your drills are new. Your x ray machine works like a charm. And then you realize that your assistant doesn't know the difference between the scaler and a mirror. Yes, fellow dentists, choosing the right dental assistant is almost as important as choosing the right implant system, maybe even more, because the wrong assistant can make your life a living nightmare. But don't worry, I'm here to guide you through hiring, training, and managing dental assistants so your clinic actually runs smoothly and you can stop pulling your hair every time someone messes up with sterilization protocols. First is know what you really need. Before you even post a job ad, take a hard look at your clinic workflow. देखो, सबसे पहले ये समझना जरूरी है कि असिस्टेंट का काम है क्या. Chair side help? Check. Sterilization and instrument prep? Check. Front desk work like billing or appointment scheduling? Maybe. Patient counseling? Ideally. Some new dentists make the classic mistake of hiring someone hoping they'll magically do everything. Newsflash, magic rarely happens in dentistry. Define whether you need a full time, part time, or even a trainee assistant, depending on the patient's budget and availability. Now, the fun part hiring is where the most dentists screw up. Give a clear job description. Don't just say looking for a dental assistant. Specify the duties, expectation. Think of it as a mini syllabus for dental assistant degree. Then interview wisely. Avoid questions like, do you like teeth? Instead, ask scenario-based questions like, what would you do if a patient faints during a procedure? Or how do you handle a nervous child? Then you can do the trial shifts. You can learn more in 1 hour of watching someone work than in 1 hour of interview chatter. Soft skills matter. Communication, patient sympathy, ये सिर्फ दांत साफ करने का काम नहीं है. पेशेंट से इंटरैक्ट करना पड़ता है. Hiring isn't enough. You have to invest in training. Now, structural onboarding. Introduce clinic policies, hygiene protocols, and emergency procedures. Don't assume they know everything. Then, hands-on chair-side training. Show them how you like your instruments arranged, how to hand your tools efficiently, how to manage the suction. Then the mentoring approach. Remember, they are learning your system, not just dental basics. Patience is key. Now, a pro tip. If they say, I know everything already, smile politely. Deep down, you know they don't. Next is communication and feedback. This is where many clinics fail. You can hire the best assistant in the world, but if you don't communicate clearly, chaos ensues. Daily huddles, 5 to 10 minutes before the day starts, discuss patient schedule, special cases, and what's expected. Then a constructive feedback loops, praise publicly, correct privately. Avoid the trap of yelling, your patients don't need free drama. Then conflict resolution, personality clashes happen. Address issues professionally. Don't let small annoyances turn into big disasters. Next is motivation and retention. A happy assistant is equal to a happy dentist. Simple math. Now the fair compensation and incentives. If your assistant feels underpaid, they won't stick around. Simple as that. Growth opportunities. Let them learn radiography, software, or even basic lab work. People like to grow. Then recognition and appreciation. Good job. Goes a long way. Bonus points for small gestures like coffee where it's been a long day. Next is handling problem stuff. Let's face it, not everyone will be perfect. Some assistants will test your patience daily. Document the issues. Track recurring mistakes or attitude problems. You don't want to rely on memory because let's be honest, humans forget. Then counseling first. Discuss problems openly. Set improvement expectations. Third is replacement decisions. If there's no improvement, don't waste your energy. Replace them before your clinic's reputation suffers. Sometimes firing is not evil, it's self-care. Then leadership and your behavior. Remember, you set the tone. Lead by example. Be punctual, professional, and respectful. Avoid micromanaging. Trust your trained staff. Over-monitoring kills morale. Maintain positivity. Stressful environments lead to mistakes. Patients notice, staff notices, and you notice. Being a dentist doesn't give you the right to act like a drill sergeant. Save that for your BCD or endodontic drills. 8 is legal and HR considerations. Yes, even small clinics need some HR sense. Employment contracts, duties, hours, confidentiality. Then labor laws and compliance, minimum wages, leave policies, and insurance if applicable. Then protect yourself and your staff. Everyone benefits. Ninth is tool and systems. Make life easier for both you and your assistant. Dental practice management software, scheduling, billing, patient records. Checklist for staff, sterilization, prep inventory, no brain required. Then SOPs, standard opening procedures. Everyone follows the same steps. Less confusion, fewer mistakes. So, fellow dentists, bring hiring, training, and managing assistants isn't just an HR core. It's the backbone of the smoothly running clinic. Spend time upfront, communicate well, train properly, and don't tolerate repeated incompetence. Because at the end of the day, a good assistant doesn't just make your life easier, they elevate the whole patient experience. And let's be honest, we didn't go to dental college to argue about where the suction tip goes, right? चलो अब क्लिनिक खोलने का टाइम है और हाँ अपने असिस्टेंट को अप्रिशिएट करना मत भूलें थैंक यू वेरी मच